originally from Uganda, and we traveled over here to get treatment for my 17-year-old brother. Around May last year, he got a severe infection which was affecting various parts of his body. It started attacking several organs, the kidney, the lungs, and the different body system. So we were admitted for quite some time, over 2 months, to combat that infection. And then it ended up in some urological issues. We even had 2 surgeries back home in Uganda to try and rectify the issue. Unfortunately, these surgeries, much as they were phased and over time, they were not quite successful. So we had to seek further medical attention. That's when we heard about King's College Hospital, London, Dubai. One of our family friends recommended this hospital. They said it has a very good urological center. And when we inquired with the hospital, we were able to find Dr. Shahzad, who handles this kind of procedure. We did an appointment with him and a consultation, and he was able to let us know what kind of treatment he would want to do and how it would help improve my brother's life. So we decided to travel and come do it.
So patient M was one of our medical tourism cases. He was 17 years old and developed acute urinary retention last year in Uganda that required a suprapubic catheter as initial catheters failed. He unfortunately developed an infection and had to have his right kidney removed. He then continued to have issues with his waterworks, and a subsequent urethrogram showed he had developed a urinary stricture. This was treated at his home country's base hospital, but the stricture recurred. And so they got in touch with us here at King's, where we suggested the Optilume urethral balloon catheter device, which is a drug-coated catheter which aims to prevent recurrence of such urinary strictures. Although it was a long stricture and that was told to him, his parents did want to proceed with the treatment, and so treatment was planned and arranged for him to have it done here at King's in Dubai. All went well. He came in, had a pre-anesthetic checkup, and we proceeded to perform the balloon dilatation of the urethra with a drug-coated balloon, which is Paclitaxel, and aims to improve his waterworks and reduce the risk of recurrence. Time will tell, but up till discharge, he was doing well with his catheter removed and was happy with his symptoms.
So the hospital was quite helpful in organizing the whole process of treatment, right from the time of the consultations to see what exactly we were going to do, and then organizing the medical visas to come for the treatment. They were even kind enough to pick us up from the airport to the hotel where we were staying, as well as helping us come to the hospital when we had the different treatments. So we did the surgery and it was quite fast. They did tell us it will be about 1 hour, and indeed it took the time that was stipulated. We were discharged the same day when they made sure that he was stable and in good condition, and then they gave us medication to help with the recovery. They also let us know the review date, after which we would come back to do review and be able to go home afterwards. We did come for the review, and all had gone well, both with the surgery and the aftercare, and we're now ready to go back home, and we know that his life is going to be much improved, and now he's going to be fully recovered after all this.
So with recurrence of urethral strictures nowadays, drug-coated balloon catheters seem to offer a much better outcome, which are minimally invasive. So if you've had a urethral stricture which was short and narrow and has recurred and requires you to self-catheterize, or you've ended up having further procedures, having a drug-coated balloon catheter as a treatment option is worth considering, as there is evidence to show that it is much better in terms of recurrence and your overall quality of life.